Hello, my name is Lisa Fitzpatrick, and before we start today, I would like to take the opportunity to give you a brief summary of my background. I have a doctorate in occupational therapy. I'm also a certified hand therapist and a certified ergonomist. In addition, I run a company in injury management, and we provide functional capacity evaluations for injured workers. I am also involved in the International Functional Capacity Evaluation Symposium. We meet every 2 years with delegates from approximately 14 countries, and our focus is to analyze the most up-to-date research involved with functional capacity evaluations and to provide a database of information so other professionals can glean additional relevant data about functional capacity evaluations. In addition, our focus is to really work on developing a standardization for functional capacity evaluations that can be used in the near future. Next, I would like to go over what concepts that will be taught today. To begin with, I'm going to be discussing what is an FCE. Secondly, I'll be talking about how the FCEs can be used and when they should be used. I will also be talking about why they should be authorized and at what point functional capacity should be authorized for the most effective determination of physical demands. Lastly, I'll be discussing concepts in research such as reliability and validity and how they relate to FCEs. Most importantly, throughout the presentation today, I'm going to provide specific examples of each of these topics listed above for you all to understand what makes a good functional capacity evaluation. So let's begin with the first concept. What is an FCE? An FCE, as the term discusses, is an evaluation or an assessment that is used for determining an individual's functional capacity or their physical demand levels as it relates to function. The evaluation is going to include multiple concepts of a person's body functions and structures, their environmental factors, their personal factors, and their health status. So what do I mean by each of these? So to begin with, body functions. Body functions are going to include things such as range of motion and strength, and the structures that might be impacted in their ability to perform mobility or strength. Environmental factors are going to be things such as their work history, their work environment, and their home environment. Personal factors can also have an impact on someone's ability to function. Personal factors may include things that may be occurring in their home life or their work life, the stress or biopsychosocial components that impact an ability to function. And then lastly is their health status. So what comorbidities may be present that impact someone's ability to function? These should all be addressed in a comprehensive functional capacity evaluation and analyzed by a trained clinician to be able to provide specific details of someone's physical demands. A functional capacity evaluation is a standardized battery of assessments. Some of the assessments may be standardized, such as in some of the dexterity assessments or some of the strength assessments. However, when you're accumulating all of the components of an FCE, there is currently no established standardization for FCE. So again, right now, there is no gold standard for a functional capacity evaluation. Many functional capacity evaluation systems exist and they promote standardization. However, most of the functional capacity evaluation systems that are used have certain components that provide standardized assessments in specific test measures. It is important for all of you to note as part of this educational seminar today that there is currently no standardization for functional capacity evaluations. This can pose a potential problem for assessments in the future and assessments that are currently being performed. Any individual can perform a functional capacity evaluation. It does not require a trained clinician. However, if you want significant and purposeful results, it is important to have somebody perform the evaluation that is trained in specifically determining function. Currently, through the American Occupational Therapy Association and the American Physical Therapy Association, physical therapists and occupational therapists are trained clinicians that are able to perform and provide results for a functional capacity evaluation. So in the next slide, we're going to be talking about why should an FCE be used. Most frequently, FCEs are used for job placements following an injury or return to work following an injury. So for example, let's take that injured worker who gets injured on the job, and he has his follow-up treatment with his physician and his primary treatment providers. They provide recommendations for physical therapy, for chiropractic care, and are unclear on whether or not this person can return to work. In many cases, a functional capacity evaluation is prescribed to determine the correct physical demand levels for this person to return to work safely. Immediately following an injury, a physician may prescribe a functional capacity evaluation to determine light duty status for the individual to return to work immediately following the injury at a light duty capacity. In addition, the functional capacity evaluations can be used to determine the physical demand level at the time of the maximum medical impairment rating using the 5th or 6th edition guidelines. So at this time, the person may be gleaned permanent and stationary, and the end results for the functional capacity evaluation are determine their physical demand levels for return to work following their permanent and stationary status. Thirdly, a functional capacity evaluation can also be used to determine how a non-work related injury or illness can impact work performance. So for an example, if someone has high blood pressure or is overweight or has diabetes, how does this currently impact their ability to perform work, and how is this impacting as a result of their work-related injury? A functional capacity evaluation is also used in determining function in a non-occupational setting. Imagine an individual who is severely injured and is having difficulty performing their activities of daily living. A functional capacity evaluation can be used to determine whether or not this person may need assistance with their functional capacity demands as it relates to activities of daily living. Many times, a functional capacity evaluation is used in case management, in intervention of treatment, or in treatment planning. A functional capacity evaluation, as I mentioned previously, is a group of assessments that can be performed and can be very useful to the treatment team in providing additional recommendations for further treatment or other things that may be necessary to help for a safe return to work or function. And then lastly, I want to talk about how is this evaluation cost effective in the claims process. Frequently, when an injured worker is deemed ready to return to work, they are not, if they do not undergo a functional capacity evaluation, there is no objective measures to specifically measure what they can do. The objective measures of their placement in physical demand levels is typically made by the physician and is more or less a guesstimation of what they can do. Most importantly, functional capacity evaluations should be used to determine a safe return to work. So how is this cost effective in the claims process? It can provide results for an individual to return to work quicker in light duty status, as well as safely to make sure they return to work without sustaining any further injury. I would like to next go in and talk about what types of FCEs are performed. There are two specific types of FCEs and which ones should be ordered. First, there is the job-specific FCE. The job-specific FCE is performed when there is typically a job analysis or a specific job duties that should be tested during the FCE. The evaluator is going to be measuring the physical demands that are relevant to a specific identified job. In a general purpose FCE, an evaluator is evaluating a client's capability to perform specific occupational demands as it relates to any occupation. This may be difficult for an evaluator to perform. As you all may be aware, there is many different physical demands that are required for any occupations. So a general purpose FCE in many cases is going to reduce the overall validity of the test. This is proved in research in a study by Pransky and Dempsey, where they found an inaccurate measurement of a worker's actual performance in any occupation in relation to these specific job demands reduce the validity of the overall test.